Good afternoon, dear colleagues. My name is Nikolay V Mozolev. I am a junior researcher and a postgraduate student. The title of my presentation today is The Efficacy of Magnetic Stimulation in Patients with Coxarthrosis. Osteoarthritis is a degenerative joint disease characterized by the progressive breakdown of articular cartilage, deformation of the joint surfaces, and consequent loss of joint function. Recent studies indicate that it affects between 15 and 20% of the global population, with an incidence rate of up to 8.2 per 100,000 people. Numerous conservative treatment modalities exist for osteoarthritis, including various physiotherapeutic methods. One of the most promising techniques is the application of medium-intensity magnetic stimulation within a range of 100 to 700 MT. One of the most common degenerative dystrophic joint diseases is osteoarthritis of the hip joint, coxarthrosis. To study the effect of a comprehensive rehabilitation program utilizing medium-intensity magnetic stimulation on muscle strength levels in patients with coxarthrosis. A pilot study included 40 patients with coxarthrosis. The mean age of the participants was 56.12 plus minus 4.9 years, and the mean disease duration was 8.67 plus minus 1.14 years. The patients were divided into two groups. The comparison group 1, N equals 20, received standard therapy, which consisted of group therapeutic exercises, laser therapy applied to the hip joint area, and electrical stimulation of the thigh muscles. The main study group, group 2, N equals 20, received the standard treatment supplemented with magnetic stimulation procedures using the exotherapy apparatus. Muscle strength parameters were evaluated for all patients. The average force in newtons of the hip flexor and extensor muscles, as well as the total work of speed characteristics, were measured using the Konchugova robotic biomechanical diagnostic system with biofeedback, manufactured by Physiomed of Germany. We measured the mean strength of the hip extensor and flexor muscles, as well as the total work and velocity characteristics using the Konchugova robotic biomechanical diagnostic device with biofeedback Physiomed of Germany. Following a course of 10 medical interventions, patients in the main group demonstrated more significant positive dynamics of the VAS scale, and an increase in the range of motion of the hip joint. According to the isokinetic dynamometry data, patients in the main group showed a statistically significant positive trend in the values of maximum lower limb extension, maximum extension strength, average extension strength, average strength of over 0.2 seconds, and the peak torque more than 0.05. In the comparison group, only an improvement in the indicators of average extension strength and an average strength over 0.2 seconds was observed, indicating the lower effectiveness of the standard rehabilitation course. No reliable positive dynamics in the other strength indicators of the lower limb muscles were noted. Thus, supplementing the standard rehabilitation program for patients with coxarthrosis with the magnetic stimulation technique makes it possible to reliably improve the condition of the lower limb muscles, which is of great importance in this pathology. The use of magnetic stimulation exotherapy, in addition to standard treatment for coxarthrosis, significantly increases the effectiveness of rehabilitation. A course of 10 procedures not only helps reduce pain and improve joint mobility, but also reliably increases the strength characteristics of the thigh muscles, according to isokinetic dynamometry data, whereas standard therapy has only a minor effect on muscle strength. This technique is recommended for inclusion in comprehensive recovery programs for patients with this pathology. Dear colleagues, thank you for your attention. I hope my presentation was informative and interesting.